Thank you, Megan. Hello, everyone. My name is Erika Herrejon, and I am the program manager for our substance use disorder here at Gateway Community Health Center. Let me go ahead and share my screen. Gateway Community Health Center is a federally qualified health center in Laredo, Texas. We're a border town with Mexico, and we're serving over 41,000 patients, and 98% of that population are Hispanics. We currently have 4 clinics in Laredo. We serve patients also in Zapata, Texas, and in Herrejon, Texas. The organization began as a subcomponent to our local health department in 1963. In 1989. In 1963, serving the migrants. In 1989, Gateway Community Health Center became independent of the local department and became a health nonprofit organization, and has been serving the underserved population ever since. Gateway Community Health Center has adult care, pediatrics, women's services. We provide dental, podiatry, pharmacy, laboratory, behavioral health, and support services. We also have a health education department, and the health education department was provided with funding from HRSA to increase and enhance the substance use disorder prevention and treatment services and mental health services in health centers. With the grant, the health education department was able to help and develop a curriculum to address substance use disorder for our community members and patients. The guide that was developed is the A.I.M.E.S for Health, and that is our substance use disorder and pain management guide. The Gateway A.I.M.E.S guide was designed to address the growing concerns of substance use disorders and prevalence of mental health conditions. The goal of the guide is to bring awareness and educate the community on health dangers associated with the misuse and abuse of prescription drug opioids, the process of the behavior changes, and support pain management practices. This guide was developed based on 8 self-management principles. One is the active learning, goal setting, problem solving, knowledge, responsibility, social support, respect, and skills building. This guide is created to be presented into 4 sessions and 2 hours per week. For 4 weeks, and the sessions include topics of misuse of medication, alternative pain management practices, mental well-being, opioids, and signs and symptoms of addiction and overdose. This guide can be used by community health workers, also known as promotores de salud, health educators, and healthcare professionals. Although this guide was designed to be presented in person after the COVID-19 pandemic, we did some adjustments so we can be able to present this guide virtually, and we decided to make it 6 sessions long instead of 4, because we are doing it virtual. We are not doing the 2-hour sessions that we normally do in-person contact. So instead, we're doing 30 minutes each session. So there's 4 modules. In those 4 modules, module 2 and module 3 can be broken down into 2 sessions each, making it 6. Okay, so the idea is that we want the patients to focus, and by doing so, they'll be able to stay in connection with us virtually longer, because if we do 2 hours per session, we'll just drag it too much, and we won't be able to sustain their focus. So the index for this guide, like I said, it's broken down into 2 modules. Module 1 is planting the seed. Module 2 is mind, body, and opioids. Module 3 is the misuse and abuse, and Module 4 is take action. The logistics of creating a cohort was a bit challenging when we transitioned over to virtually after the COVID-19 pandemic. How we recruit patients is that we have health educators that go to our waiting areas. They do a brief presentation on our program. They gather their contact information, and when we're ready to create cohorts, we give them a call and we explain our program, what we have, and if they're interested, we guide them to do our sessions virtually. The thing is that there were some barriers we faced because most of our patients are elderly and they're not very tech savvy. So we did encounter some barriers that we had to show our support, and we helped them download the Zoom, be able to navigate through the platform, and that's how we are doing now. We started in January, so we're in our 2nd cohort for this year, and it's getting better. But we do have to kind of train the patients to be able to navigate the Zoom, and or sometimes we use FaceTime as well. Anything with a camera, because a lot of patients do not have access to internet or do not have a smartphone, so that creates a little bit of an issue. But throughout the way, we reassure them that we are here for them and to help them figure out a way on how to connect. Okay, so module 1, it's planting the seed. So in this module, it's the beginning of the guide. And according to the Centers for Disease Control and Prevention, opioids, including prescription painkillers, heroin, and fentanyl, killed more than 42,000 people in 2016, more than any year in record, with higher overdose rates in rural areas. The opioid crisis has greatly impacted agricultural workers, mainly due to the nature of their workforce, and are more likely to be prescribed opioids than many other Americans. The guide not only provides agricultural worker and the community with health education information, but also with alternative pain techniques that can be implemented into their daily routine to help alleviate the pain and discomfort rather than turning to medication. So this is what this guide is. It's to provide awareness and education that there's something else out there and not just turning to medication. They'll learn ways to manage their pains by performing other alternatives, and this is what we're going to learn today. So this is an overview of module 1. You, as a facilitator, you will explain to the patients the objectives. By the end of the sessions, they will be able to review information about opioids and the health risks associated with them, receive information on the history behind the association of pain and opioids, evaluate their own risk of develop opioid use disorder, practice goal setting process, and practice a alternative pain management technique. As a facilitator, you want to have all the materials readily available before your session. This facilitates the process when you're about to present the module. Always have extra just in case you have unexpected people joining the class, or somebody brings a friend. You always want to be ready to have all the material needed. Okay, and the guide is divided into 4 modules, and each module is structured to include different styles of learning to sustain the participants' attention. It's very important to keep the participants focused and engaged during the session, and that is why we do a combination of learning styles. We do activities, we do demonstrations, we have discussions, we have lectures, and like I said, it's a way of keeping the participants engaged throughout the modules. Okay, so what you want to do is you want to create a file for every participant where you can keep all their forms. At the beginning, we do give them a consent form. We could keep their goal processing forms in there, and etc. Whatever the forms we have throughout the modules, we can keep track of them. We keep them with us. That way they won't misplace them or forget to bring them with them the following session. Okay, so moving on, this is the lesson plan for the facilitators, and it is recommended that the sessions are conducted by 2 facilitators if it's done in person. If this will be done virtually, one facilitator will be enough to conduct the classes. It is recommended the facilitator to be prepared before the classes to review the material, to have everything beforehand, have copies, and to go over the teaching methods that will be used to conduct the classes. Like I said, let the patients know that what they will be doing throughout each module. That way they'll have an idea of what to expect throughout the class. Okay, so here is our first activity, and our first activity, it's an icebreaker. This style of learning is interpersonal learning, and this is how we're going to get the flow going. We're going to get everybody to know each other, create a bond, because we'll be together for the next 4 weeks or 6 weeks if it's done virtually. So in this group activity, we want to let the participants know that interaction is very important, and we work more effectively when we work together as opposed to isolating ourselves and not participating. We want to make the class fun and be in tune with everybody else. So moving on, we have a discussion. What we do with the discussions is we could have either a whiteboard, a flip chart, something where we can write and the responses. So we're going to engage in discussion. We would want to invite everybody to participate. And as you're asking the questions, you can write down the answers on your board. And that way, the participants, they could also take notes. They're encouraged to take notes. And whatever you're writing, sometimes they'll take a picture or they'll write them down. And that is why it's easier to have a board readily available. That way we can write the responses for our discussion. If this is done virtually, you could also engage with the participant. You could do the same, or you can do it as a conversation, as in like you're asking the participant for the questions, and then they'll, it's a conversation. But we could also use the same method with the flipboard or the whiteboard. And we move on to a group activity. In the group activities, we want to encourage 100% participation from the participants. This is a team bonding group activity. And the purpose of this activity is to encourage participants to actively work with a healthcare team to evaluate the benefits and risks associated with their pain management treatment plan. So here we have this group activity, and if it's being done virtually, you can explain to the participant that you will be showing them a flashcard, and they'll be able to tell you if it's a risk or benefit. And at the same time, you can make it interactive and ask them, well, why do you think it's a risk, or why do you say it's a benefit, and why not the opposite? Because that's how you're going to engage the participant into conversing and getting into the rhythm of the module and participating. We want the participants engaging at all time, because that's a form of them learning and applying what they're learning. Okay, so here we provide a lecture of the history of opioids. So basically, the the facilitator will lecture this to the participants on how the opioid started and what led to the opioid crisis we have now. And this is to increase the participants' knowledge on the opioid crisis, so they can have an idea of what led to what the crisis is right now. They'll have a little bit more of knowledge on that aspect. And here we provide them with the drug schedule. And this is to increase the participants' awareness on the scheduling of prescribed opioids. With this, also, we encourage participants to either take a photo of it, we give them resources, the copy, because they'll know which drugs are high risk of abuse and which ones are the lower risk of abuse. Some people don't know that the cough syrup, can become people can abuse them, or they didn't know, the categories. So with this, it's very important tool to provide the participants with. Okay, so activity 3 calls for opioid risk tool, and this is an individual activity. We provide the participants each with the opioid risk tool, and the purpose is to assess risk for opioid abuse among individuals utilizing a self-screening tool. With this, it is encouraged for the participants to engage individually with the facilitator in case they have questions or they don't know how to read their score, or let's say they do score higher and they might be afraid that they're at risk. We can provide them with resources as to what to do next in a more private setting on a one-to-one basis, as opposed to a group thing where they expose their concerns and they don't want other people to know. So I'll always make that clear that you're able to meet with them at any point of the class, that you're available for them if they want to discuss anything in a more private setting. It could be done another day after class by telephone, but give them that option. Okay, so now we move on to goal setting. It's introduction to the concept of goal setting. As a participator, you're going to explain to the participants that changing a behavior may not always be easy, but setting goals always allow them to work for and achieve a healthier lifestyle. So here we're going to provide the participants with a goal setting form. And this form, we're going to let them know that they're going to establish goals during this module, which is the first one. And it could be anything from eating healthier, incorporating more exercise into their daily routine. It could be reading or doing a hobby, anything that they would like. But we have to remind the participants that at every module, every week, we will go ahead and revise. We're going to review the goals, and we're going to see how they're doing. And that's why I said we're going to keep that form with us. That way they won't forget to bring it the following day, the following time we meet. We could advise the participants to journal it at home. That way we can just transfer it when they come over here. And there can be modifications throughout the modules, depending if they want to change a goal or they want to increase the days they exercise. Just let them know that they can make modifications at all times. Okay, so the following style of learning is a visual demonstration. And what this is a demonstration of Tai Chi. So here we play video of a short clip from the National Arthritis Foundation, and we have the following options. We have shoulder exercise, stretches of the spine, stretches of the neck, and we encourage the participants to practice this exercise. We tell them it's low impact. They're not going to be doing things strenuous. However, if they do not feel comfortable, they could always opt out and observe the other participants. As a facilitator, you want to do it with them. You want to facilitate the video as well in case they do need help or they are not sure they're doing it right. You can assist them with that. And this is a pain management technique they can use for relaxation as well. And here I included the video. If this is done virtually, they could also do it at their house. Just let them know that they'll need a little bit of space. You could put the video and you could do it with them through the screen. Okay. Okay, so that concludes Module 1. At the end of every module, we do give a handout to the participants, and that is just supportive information, like educational material they can use, take home, and review. So you want to thank the participants for attending, for their attention, for their participation, and invite them to return to the next session, and always encourage them to bring somebody. Sometimes they'll feel comfortable or better when they have somebody come with them, a relative or a friend, and that's totally okay. They can bring whoever they want to the following session. Okay, and here we attach all the document forms that we talked about throughout the module. So here is the activity for Module 1. This is the Opioid Risk Tool that we provide the patient with. And this is the goal setting form that I was telling you about. And this is, like I said, they have the option to do physical activity, healthy eating, medication. They'll take the medication as directed and not when they have pain or, the pain's not going away and they keep on taking it, rather than doing an alternative as in like something more relaxing that it could help with the pain. So this is the form we provide them with. Okay, and this is the educational handout we give them, and this one is talks about stress. So this is just information for them to take home. We wanted to let them know that making lifestyle changes can be difficult, even more when a person is experiencing pain. It is necessary to focus on making changes one step at a time. Get to know your body and your capabilities and limitations. Change will occur when the person is ready, willing, and able to do it. Don't stress. Stress can affect our physical and mental well-being. So this ties back to our goal setting. It's okay if they're not ready to change or to follow through with their goal, or maybe they don't want to do it 5 times a day, the exercises, maybe they just want to do 2. This is to reassure them that it's okay to do small steps at a time. So now we move on to Module 2, and this is Mind, Body, and Opioids. And this is the overview for Module 2. Again, as a facilitator, you want to let the participants know that at the end of the sessions, they will be able to review information on how opioids interfere with brain and body function, discuss how our mental health can be affected by stress, opioids, and pain, practice relaxation techniques, and set goals to improve physical and mental health. Again, have all your materials ready as a facilitator, have extras just in case somebody decided to bring a friend this time. Always be prepared with your material and the patient's files you created from Module 1. Okay, so moving on, after greeting the patients, welcoming them back, let them know that you're happy they're back. For the second module, we're going to do the goal review. So here we're going to allow 10 to 15 minutes for patient to review their goals with the group if they like. And if they want to review it individually with a facilitator, we can do that as well. We can do it during that time, or we can do it after, however they feel more comfortable, but always give them that option that, you're available for them to meet with them in a more private setting, because a lot of people don't want to be participating or expressing their concerns or, their opinions in a group. So let them know that it's okay to do it in a groups in a individual setting. So you're going to review the goals. If the participants did not start for whatever reason, always encourage them and empower them to continue. Maybe they didn't work well for the first week, but they can still continue right now. They can improve, or they can, and if they did good, maybe they could add more days or another goal, like always encourage them and empower them to continue to better themselves. Okay, so and we head on to a group activity. And this activity, it's the purpose of it is to bring awareness on how easy it is to repeat a pleasurable action. So for this activity, it can also be done virtually at home. What we do is we have cards, and then we tell the participants that we'll be reading pleasurable actions, and if they think it's pleasurable for them, they'll go ahead and jump or raise up their hand, and this will show them that it is easy to repeat pleasurable actions. For example, you're going to say, I will eat a chocolate bar, I'll have a cup of coffee, and they'll jump. And they'll see that the reward system in our brain gets activated and releases dopamine. Dopamine is the chemical that gives us a pleasing feeling. It is easy to repeat actions that provide us with pleasing feelings. These feelings of pleasure are felt normally in our body when we eat, drink, sleep, or have sex. Okay, so like I said, this can also be done virtually with the participant. If they don't want to jump or get up at home, they could easily just raise up their hand. Okay, the following we have a lecture. For this lecture, we have some visual aids that we like to use when providing lecture to the participants. This is Polly. So Polly is our mascot for our curriculum. So we use this, and we also use the image of the central nervous system, and this provides a little bit more of a visual demonstration for them when lecturing on the content. Okay, and the following activity is activity I think. And the purpose of this one is to reflect on how our pain can make us feel negatively and affect our mental health. And on this one, we also have a visual aid. It's a little bit bigger. And this one, we put it on the wall, and it's that image you see on the screen. So it's the brain. We ask the participants to think of negative thoughts they feel when they're experiencing pain. And we'll give the opportunity to whoever wants to participate, and they'll write their feelings. If this is done virtually, they could also participate. They can let you know what they're feeling, and you as a facilitator, you can write down their responses on that laminated image of the brain. Okay, so the following is a discussion. As the other discussions, we always want to engage the participants to participate by writing their responses on the flip chart or on the whiteboard, and always make it a discussion where everybody feels they can participate, and they don't know if they're right or wrong, because sometimes that's why they don't want to answer, because they don't know if they're right. But you, as a facilitator, as you can see in the screen, that it always gives you the responses to the discussions, and you can help them out, by engaging them with the responses yourself. And as well, this can be done virtually with the participant the same way, by conversation. So here we have a auditory demonstration. This is the learning style for this module, and we have a relaxation technique demonstration. So what this is a breathing meditation that we do. It's auditory, so there's no video. We'll just go ahead and tell the patients that we'll be listening to an audio, and we're going to be following what the instructor tells us. And we have 3 different ones. The one we do the most is the breathing meditation, just because it's 5 minutes, and sometimes we don't have the full time to do the 12 minutes or the 19 minutes, but it's up to you which one you want to do with them. And this one can also be done virtually. You let the participant know that they're going to listen to an audio, and we're going to be doing breathing meditation together. Okay, so always encourage the participants to practice meditation activity or any other activity. At first, they might be embarrassed or they don't want to do it, but invite them, like maybe you don't want to try it right now, or maybe you want to do it at home, it's perfectly fine. Always provide your participants with the resources, maybe with a link of the videos you showed them that day, or handouts, anything that maybe they don't feel comfortable doing it together. They could do it on their own. Okay, so that brings us to the end of Module 2. Again, we give the handout distribution, and we thank our participants. One thing that is very important to let them know is that if they ever have a question, they do not have to wait for the following session to contact you. Always make yourself readily available, and provide them with your contact information. If they have a question, a concern, or they need help or something, they can always reach out to you, and they don't have to wait till they meet again. So here are the attachments for this module. This is the handout, and it's understanding mental health. Why are social bonds important? So as a facilitator, you're going to express to them that staying positive and connected to others is important for our mental wellness. Maintaining positive thoughts, attitude, and behavior can help us live happier and a more relaxed life. So this is something they can read when they get home, or perhaps it's a resource they can provide their family or friends with. Okay, so the next module is misuse and abuse. Okay, and in this one, as a facilitator, you would want to let your participants know that by the end of the session, they'll be able to discuss pain and its association to addiction, identify signs and symptoms of addiction, obtain information on the most commonly abused prescribed medication, identify signs of overdose and review information on naloxone, obtain information and practice an alternative pain management exercise, as well as set goals to improve physical and mental health. Okay, so again, we will review the goals with the participant. We will let them know, we will congratulate them on their accomplishment. If there are some who have not quite met their goal, always support and encourage them to continue. It doesn't matter, we're already on the 3rd week of the module. They could still start or continue, or add to their goals. They can always modify their goals. So always, maybe sometimes they don't know what to do, and you could provide ideas. Tell them, how about do you like to cook? Or do you like to plant? Do you like to crochet? Like that could be a goal, because you could practice it longer, as opposed to, let's say, well, yes, I know how to crochet, but I haven't done it in a long time because I've been super busy. Well, here you could let them know, well, this could be a goal for you now. You could start doing crochet more, and perhaps you could, use this as a form to de-stress, or, as a hobby. And that could be something they could work on and put it on their goals. Okay, so and moving on to our first activity of Module 3, this learning style brings us a group activity. And the purpose of this group activity is to bring awareness to different ways someone can misuse or abuse prescription medication. Okay, and in this activity can also be done virtually. You're going to explain to the participant that you will show them a flashcard with a scenario, and you will decide if that is a form of misuse, and to explain why the scenario is a form of misuse and what they would have done differently. So this can be done in group and can be done virtually. What we do is we provide them with scenarios, and they'll tell us, yes, it's a form of misuse, or no, and we'll ask them, why do you think it's a form of misuse, or why don't you think this is a form of misuse? And if it is, okay, what can we do so it won't be a form of misuse? What differently can we do? So it's all about engaging them, making them think, making them participate and engage and stay focused throughout the modules. And here we have another discussion, and this one is prescribed medication. So again, you want to engage the participants to participate, providing them with the responses on the flip chart, on the whiteboard, whatever chalkboard, whatever you have, because like I said, a lot of them like to take notes and engage in the discussion. For instance, this one asked, state some of the reasons someone would misuse prescribed medication. So they're going to provide you with their reasons. Why do they think that someone would misuse prescription medications? And then we also provide with like the reasons, people, in case they don't provide you with a lot of them or any of them or just a few, we add some more, and that way we also add them to the responses on the board, and they'll have a better overview, understanding of why someone would misuse prescription drugs. Okay, so here we have a lecture, and this lecture is designed to increase the participants' knowledge on the most commonly abused prescription medication. It's always after the lecture, we also want to engage in a meaning discussion for the participants, just to make sure they're understanding the content that is being given to them. And if they seem like they don't understand it, we could add to it, and that's where we have our facilitator notes, where we could provide more information to them. But that discussion is how you will, engaging them in discussion is how we will know if the participants are focused and if they're enjoying the modules, or what can we do different to grasp their attention. Maybe we need to add more visuals or more activities, because that is how their attention will be there. Okay, so we move on to an activity, and this learning style is a group activity. And the purpose of this activity is to identify signs that are typically associated with addiction. So for this activity, we place 3 large signs on a wall, which is the physical sign, the behavioral sign, and the emotional signs. And then we'll have smaller cards that are signs of addictions, and we're going to place them where they think they go. So this activity can also be done virtually, the same way. We can read, as a facilitator, you can read the signs of addiction cards to the participants over the screen, and they'll let you know, oh, I think that's behavioral. So you'll put it under behavioral. Once they're done with the cards, you'll let them know if the cards were placed in the right category, and if they weren't, why they weren't, why they belong somewhere else and not where they thought it was. So this is also another little mini discussion that forms from this activity. Okay, so moving to activity 3, another group activity, and this the purpose of this activity is to demonstrate how naloxone medication attaches to the opioid receptors to reverse or block the effects of an overdose. This is a group activity. However, if you're doing it virtually, you can either do a video demonstration on YouTube on how to administer naloxone, or do a visual demonstration of naloxone itself. What we have here is the actual naloxone spray, the nasal spray. So we do is a visual demonstration, and they'll know what it looks like, how it comes, how it's packaged. So that's another learning style that we use in this activity, because it's a visual demonstration. Okay, so the following activity is a relaxation technique, and this is a yoga demonstration video. So as a facilitator, you can explain to the participants that yoga can be modified for individuals with certain health conditions, strength, and experience. They do not have to do it full out. If they don't feel comfortable doing it, they don't have to do it. As always, they can observe. Maybe they want to practice at home, but always provide them with the resources, the links, in case they want to do it, they want to practice it at home, or perhaps they want to give it to their daughter or to their mom, to their sister, a friend, but always, provide them with the resources for that module. So here is a 3-minute yoga video we do. And we always encourage the participants to practice, even though if it's done virtually, they can still participate as well. You will tell the patient that they would just need a yoga mat, or a open space where they can do it. You will do it with them as a facilitator, and you will do that little activity together. So this concludes module 3. We handled we distributed the handout to the participants. We thank them for coming, and we tell them that the following week will be their last module, which means they will be having their graduation ceremony if it's done, if it's an in-person session. Okay, so, and that you will provide them with the ceremony and more information on the program, the closing of the program. And here are the attachments. So the tools for this module. The handout for this is let's stay busy, engage in a healthy hobby. So explain to the participants the benefits of practicing a healthy hobby. You can let them know that a hobby is an activity or exercise that is done regular for enjoyment, something they like to do. Maybe, like I said earlier, they like to crochet, but they haven't. Maybe the time is now to start doing it, or they used to bake and not anymore. Anything, and give them reasons, like the ones we provide. Like having at least one hobby will help reduce stress, will help with patience. They won't be bored. Helps them stay away from bad habits. Always provide them with that education as to why it's important to have a hobby, to practice a hobby. to do a yoga video. Maybe they liked doing the yoga video so much that now they want to do it more. They want to implement it into their routine, or the Tai Chi, give them that ideas that, to practice what they like and make it a hobby. So we are at our last module, and this is module number 4. And as a facilitator, you want to let the participants know that by the end of the session, they will be able to discuss the negative impact that drug misuse and abuse has in the community, receive and discuss information on proper medication disposal, practice art relaxation, receive information on alternative pain management practice. Okay, so here we will review the goals for the last time. Okay, so we will congratulate the participants for their, for their attempt to work towards their goal and better their lives. If participants did not do so well, or they haven't gotten around to doing their goals, empower them that they could still continue. Just because the program is going to end, it doesn't mean they're going to stop or they can't do it anymore. They can continue. We want them to create a lifestyle. We make it a lifestyle and not just something that, oh, it was temporary because it was only for the modules. Like, no, we want this to be a way of living for them. So the following activity we have is Activity 1, proper medication disposal. And the purpose is to reinforce proper medication disposal. So this activity is a visual demonstration. So what we do is we get a Ziploc bag with used coffee grounds and M&Ms, Skittles, any candy that you have that can resemble the pills. And this is a way to demonstrate the proper way to dispose medicine. So once it's like this closed, you can dispose it in the trash can and not just throw the pills like that in the trash can or throw the bottle, because that is not the proper way. And here we provide information for the facilitators as to other ways they can mention. Like medicine take-back options. That is another option they can do. Flushing certain potentially dangerous medicines in the toilet as well. So we have different ways of doing it, but always let them know that there's proper ways of getting rid of the medications properly. Okay, so the next activity is a art relaxation activity. And the purpose of this activity is to encourage creative and mental wellness. So what we do here is we provide art supplies to the participants. We provide them with like the canvas, the paintbrushes, and the image of what to draw. We have everybody drawing, and it's a form of relaxation. However, if it's done virtually, we can't have the same experience, but we can provide a video for them. And this is an artistic relaxation video. This is something that we can watch on virtually, and perhaps or encourage them that they could do it at home. They could get their supplies and use art as a technique to relax. Okay, so this brings us to our closing of the module. We want to congratulate the participants and acknowledge the effort that each one put into the course for their accomplishments, their hard work, their commitment. We do provide a award ceremony for them where we give them their certification of completion, as well as a framed group portrait. If this is done virtually, what we have been doing is that we can provide the participants with incentives and educational material, and that's if funds are available, right, for whoever's doing it. Since we can't do the full-on graduation ceremony at the moment, but hopefully, with time we get back to doing that, because it's more interactive. It's more exciting because it's actually hands-on, but we're trying our best to provide the participants with more visual aids, more excitement. We're working on ways to keep them engaged, because we want to see things on when somebody's presenting. We want to be able to visualize and create a story and see what we're talking about, and not just provide a lecture with talking and no visual aids, no demonstrations. So that is our goal, to continue improving on our curriculum. So this is the attachments for this module. Here, the handout that we provide to them is Know Your Options. Integrating complementary health approaches can help us lead a healthier life. One must know their options, get informed. Education is a key. And this is just for them to know that they have options. They have, it's their they need to take the approach to be able to make their life better, by educating themselves with classes like these. By taking a class, they're able to expand their knowledge on, what to do in a case like this, or, if they know somebody that's misusing medication, they'll be able to provide them with this type of information, because not all the people that take our class means that they're misusing prescription opioids, or this is just for them to increase their knowledge. Maybe they have a relative, maybe they have a friend, maybe it's themselves, maybe they just find classes to take just to increase their knowledge and maybe make it a hobby. Maybe a lot of elderly people don't have much to do or not working, and they look for these type of classes to become part of their knowledge, where they get their knowledge, or they socialize with other people. So always let them know that we have these programs for their benefit. So I want to thank everyone for their time. I hope everybody enjoyed this presentation. If you have any questions, need more information, please feel free to reach out to us. I have included Gateway Community Health Center information, my information, Erika Herrejon, and my director's information, Otilia Garcia. Again, thank you so much and have a wonderful afternoon. Thank you.